Hi, my name is Dr. Jessica Van Scyoc, and today I'm going to show you how to take your horse's vital signs. It's really important to know how to take your horse's vital signs for a couple reasons. The first one is because you want to know what's normal for your horse. Every horse is different, so if you know what's normal for your horse, it's easier for us to determine when there actually is a problem or your horse is sick. Secondly, it really helps the veterinarian if you're able to tell them what your horse's vital signs are when there is a problem. That can help us decipher what's wrong and determine if we need to come out and treat your horse or if there's something you can do at home. So the supplies you'll need to take your horse's vital signs: you'll need a watch with a second hand. You'll also need a digital thermometer that you can buy from CVS. I don't like to use mercury thermometers. And finally, it's not essential, but it's helpful to have a stethoscope. You can buy a cheap stethoscope for $15, and it's suitable for this purpose. So you'll want to perform the exam in a place where there's good lighting. You'll also want it to be a quiet area so that your horse isn't excited, because that can affect his vital signs. I like to begin by standing and observing the horse from afar. You want to observe their attitude. Are they acting normal, or are they dull, lethargic, or anxious? Secondly, you can observe their respiratory rate by standing away from the horse as well. You can watch their flank move, and you can also watch their nostril flare. You're going to want to count the breaths they take within a 15-second period and multiply that number by 4, and that'll give you the breaths per minute. So a normal adult horse is usually between 12 and 18 breaths per minute, but that number can vary, especially for foals and for miniature horses. So next, I like to check the color of the gums. So I'll walk up and I'll peek at the gum color of the horse, and you want their gums to be a nice pink. You also want them to be a little moist when you touch them. So next, we're going to check the capillary refill time, and I do this by pressing my thumb into the gums and blanching the gums. You're going to watch for the color to return, and it should take under 2 seconds. This is a crude measurement of blood pressure. And if your horse has pale, brick red, or purple looking gums, this is not normal. Next, we're going to take the heart rate, and you can do this in one of 2 ways. The first thing you can do is feel for the facial artery under the mandible. So it's a soft, fluctuant artery, and it's about the size of a pencil. And you're going to softly place your fingers against the artery and wait for it to pulse against your fingers. You're going to take this measurement for 15 seconds and multiply by 4 to get the beats per minute. If you have a stethoscope, you can move back behind the left elbow of the horse and place your stethoscope against the thorax. You're going to listen to the heart rate for a few seconds to get the rhythm normal. And then you're going to actually take the measurement. So each lub-dub of the heart counts as 1 beat. And again, you're going to test for 15 seconds and multiply by 4. And the normal heart rate for a horse is between 28 and 44 beats per minute. Again, this will be higher for foals and minis. Now we're going to move back and listen to your horse's gut sounds. I like to listen in the upper and lower areas of each flank, and each normal horse usually has a couple gurgles every few seconds. So if your horse is acting colicky or sick, you may notice that these sounds are decreased. Finally, we're going to move back and take the horse's rectal temperature. So always let the horse know that you're coming and pat him on the rear end before you insert the thermometer into the anus. You're going to wait for it to beep, and a normal rectal temperature for a horse is between 99 and 101.5 Fahrenheit, and that'll be a little bit higher for miniature horses and foals as well. So in summary, a respiratory rate should be between 12 and 18 breaths per minute. A heart rate is normally between 28 and 44 beats per minute. The temperature can be between 99 and 101.5 Fahrenheit, and these values will be a little different for miniature horses and for foals. I hope this helps you take vital signs on your horse. It's an important thing to know how to do, and it can help speed up veterinary care if needed.